And in a different field, the opposite problem. Healthcare workers are being overworked. Every year on Thanksgiving, hospitals are filled with staff working instead of spending time with family. And while this year is no different, there's a new added pressure. COVID-19. Jesse Cohen tells us how some hospital staff are handling working holidays with the pandemic.
Over the last 9 months, hospital staff have seen the realities of what COVID-19 can do to their patients. And here today on Thanksgiving Day at U of L's Mary and Elizabeth Hospital, patients and staff are inside without their families. Registered respiratory therapist Kevin Melzer has been on the front line since the very beginning, and that means not being able to see much of his family because of the possible risk. He's reminded of that this Thanksgiving when he's working in the hospital, and he says he's been willing to share his time with people who need it a little bit more than he does.
Because being a respiratory therapist, a lot of my patients are unable to talk because of being on the ventilator. But it's terrible. It's not fun being away from family, not being able to have visitors. And then when patients are sick and dying in that situation, they still can't have anybody at their side. So it's even more sad to see that happen during these times.
Kevin says he's grateful that at the end of the day, he's able to go home to his families, something his patients aren't able to do.